Hi, I'm Colleen Cullinan. I'm a pediatric psychologist at Nemours Alfred I. DuPont Hospital for Children, and I'm going to be talking about the do's and don'ts of discipline. So oftentimes when families come to see me, they have questions about a lot of different behaviors that they're hoping to get rid of or see less of. So they have questions about, how do I eliminate temper tantrums or whining or cursing or throwing or hitting or kicking or biting or talking back, stealing, all kinds of different things. And what they're really asking about is, how do I reduce the frequency of some of these behaviors? And that's what discipline is all about. It's selecting a target behavior and then creating interventions that are designed to reduce that kind of behavior. And so that's what I want to talk about today, are some specific interventions that are designed to reduce problem behaviors. The first intervention I want to talk about is ignoring. So ignoring is based on this idea that kids do a lot of different kinds of minor misbehaviors as a mechanism to get their parents' attention. And so ignoring is based on this idea that we're trying to get rid of all parental attention for behaviors. Now, ignoring is the most effective and should be used for behaviors that are annoying but are safe. So things like whining or using a baby voice, these are all really great behaviors that you can practice ignoring with. Behaviors that are dangerous or aggressive, these aren't behaviors that can be ignored, so you'll have to use a different kind of strategy for something like that. When I talk about ignoring with families, I usually will draw this graph that I'm about to show you out. So it's really important to prepare families for how ignoring is going to go to make sure that the intervention is actually effective. So I'll draw this out, and I'll usually use whining as an example because I find this the most annoying behavior. And I will talk about whining. I will say, let's pretend you're on the phone. Let's say you're doing something, you're in the middle of something, you're on a phone call. And your child starts whining, trying to get your attention, trying to get you off the phone. That whining might start at an intensity of like 40%, let's say. And when you start ignoring, predictably what will happen is the intensity of this behavior will increase sizably and quickly. In psychology, we call this an extinction burst. So ignoring happens, you remove all of your attention, and this extinction burst happens where the rate of behavior increases dramatically very quickly. The story I like to tell families is it's kind of like an elevator. When you walk up to an elevator and you press the button, when the button doesn't work, what do? You press it really furiously, like 5 or 6 times, to see if the elevator is actually working. And that's kind of what kids are doing with ignoring. They start whining, and when it doesn't work, they push the button really hard and fast to see if this machine's really broken. And that's what they're doing with you. So the intensity of whining will increase significantly, quickly, and this is what we call an extinction burst. And I like to tell families that this is probably going to happen so that they're prepared, because the top of this arch, this graph that I'm drawing out, is a really important point. This is the breaking point. Someone here is going to break. It's either going to be you, the parent, or the child. Hopefully it's you, the parent, because if you can kind of wade through this top part of the arch where it's the most kind of annoying and the most frustrating, if you can hold through, ignoring works beautifully, and that behavior will disappear very, very quickly. If your child breaks, you've taught a very important lesson to that child, which is, I wasn't taking you super seriously at 40%, so the next time you should just start at 100. Start with the most intense behaviors. That's how you get my attention. So ignoring is a really important intervention to orient families to, that there's going to be, behavior will get worse before it gets better. And your job as the parent is, once you've made the decision to start ignoring, you have to ignore from now until forever. Because if you choose not to ignore, you're actually running the risk of increasing these problematic behaviors. So families will sometimes come back to you and say, we tried ignoring and it didn't work. And that might be because we haven't fully prepped families for the fact that ignoring is a really hard strategy. It's one that I don't recommend to every single family, but when I do recommend it to families that I think have good frustration tolerance skills or distress tolerance skills, it works beautifully. The next kind of set of interventions I want to talk about has to do with effective command giving or effective communication. So when you're giving commands, it's really important to establish good proximity and good eye contact. You want to be close when you issue the command. You don't want there to be any confusion about what the command is or what's going on. You want to be close to the child and making good eye contact. And then you want to very quickly assess if this is going to happen or not. So if you make a command, you're nice and close, you have good eye contact, the command is simple, you say, go brush your teeth. You should be able to know within about 5 seconds whether this is going to happen or not. The child is either going to be moving their body to go brush their teeth, or they won't be. And so I like to empower families to make that decision pretty quickly, because once you know whether compliance is happening or non-compliance is happening, you can make some decisions. If compliance is happening, awesome. You can offer praise, rewards, high fives, affection, whatever it might be. If there's non-compliance, you want to offer 3 pieces of information, and I call these 3 pieces of information TLC. So TLC is a very specific way of repeating the command to increase the likelihood that it's going to be followed. So you'll repeat the instruction, And then you will offer a time limit. This is really important, especially for kids who have symptoms of things like ADHD, who might not completely understand the time construct. Giving a limit can be really helpful. And then you want to offer a pre-stated consequence for what would happen if the command isn't followed. So an example might look something like this. If my original command was go brush your teeth, what I'm going to want to say in TLC is, if you don't go brush your teeth, in the next 10 seconds, I'm taking the iPad and I won't give it back until tomorrow. Go brush your teeth in the next 20 seconds. If you don't brush your teeth, you're going to have to go to bed 15 minutes earlier. So this is an example of the TLC script. It's really nice because it helps give parents language about how to give commands and how to follow up and follow through after commands are given. And it allows parents to give consequences in a way that's neutral and scripted and takes the emotionality out of giving consequences. At the end of TLC, if the child has followed through and done what they're supposed to do, complied, awesome, you can praise that compliance. If they don't, then you already know what the next step is, and so does your child. You've provided the expectation that a consequence will be given. The last intervention that I want to hit on is timeout. Timeout is based on the attention rule, which suggests that your attention is the most valuable thing to your child. And so timeout, a little bit like ignoring, is about removal of your attention and removal of any sort of stimulation, and that's really the consequence. Timeout should be in a safe place, a boring place. The rule that's kind of out there in the world is that it should be about 1 minute per year of age. However, there's data that suggests that 3 minutes is perfectly long enough, whether you're 3 years old or you're 7 years old. So I oftentimes encourage families, especially for kids who have a lot of dysregulation, to keep timeouts a little bit shorter. If there's non-compliance during timeout, if kids are up out of their seat, or they're really dysregulated, or they're screaming, or it's just not going well, I will add another minute onto the time of timeout. And if there's more non-compliance, I'll continue to add minutes. I won't do that forever. If by the third time there's still non-compliance, what I'll usually do is encourage families to take away one privilege for 24 hours. So sometimes it's helpful with timeout to just wait it out, to do a really long timeout and keep putting kids back in the chair, letting them have it out, and that can last for a long time. For little kids, that can be particularly effective. But for older kids, this is the way I prefer to do it. If after the third time of having to instruct the child to sit in timeout, I'll take away a privilege. Like tomorrow, there won't be screen time, not for the next 24 hours. Timeout ends or is over, it's not only just based on the time. It should be when time is served, but also when the child is quiet and regulated, because otherwise what the child learns is that they're whining or screaming or crying or pleas to let them out of timeout is what got them out of timeout, as opposed to their calm, regulated, prepared behavior to come and be compliant. So in conclusion, when you're trying to make discipline effective, use discipline strategies along with positive reinforcement strategies. I didn't spend a lot of time talking about that in this talk today, but it's really important when you're using strategies like timeout that you also make sure that there is time in. Opportunities for kids to receive praise, receive positive attention. That's really important to make discipline strategies effective. Effective punishments are usually given immediately and consistently. They should be carried out in a calm, neutral, matter-of-fact way. I oftentimes encourage families to be robots when administering discipline. And we want to try to make punishments logical and fit the situation. Thank you so much for the opportunity to talk about discipline. I hope it was helpful.